Low air humidity is a frequent reality in many regions of Brazil, especially during the winter months and in periods of drought. This phenomenon can significantly impact the health and well-being of the entire population, particularly children, the elderly, and people with chronic respiratory diseases. In this video, learn what to do in the face of low air humidity to protect your health and ensure more comfort in your daily life. What is low air humidity? The relative air humidity measures the amount of water vapor present in the environment in relation to the maximum the air can hold at that temperature. Levels below 30% are already considered critical by the World Health Organization, WHO, and values below 20% indicate a state of maximum alert. Effects of low air humidity on health. Low humidity causes several problems for the body. Some are noticed almost immediately, while others may arise if prevention and protection measures are not taken. Drying of mucous membranes. The mucous membranes of the nose, throat, and eyes dry out, becoming more susceptible to irritation, infections, nosebleeds, and respiratory allergies such as rhinitis and sinusitis. Worsened respiratory diseases. Diseases such as asthma, bronchitis, and pulmonary emphysema tend to worsen in periods of dry air due to the decrease in protective mucus in the airways, facilitating attacks and viral or bacterial infections. Dehydration and general symptoms. The body loses water more easily through sweat and the process of breathing. If there is no replenishment, symptoms such as headache, fatigue, dizziness, a drop in blood pressure, and dry mouth and skin appear, in addition to making perspiration and the regulation of body temperature difficult. Irritation of the skin, eyes, and lips. The skin becomes drier, with a tendency for cracking and itching, while the eyes may present a burning sensation and redness. The lips crack easily, requiring special care. Cardiac and systemic risks. In extreme situations, especially for people with pre-existing diseases, low humidity can thicken the blood and increase the risk of cardiovascular problems, such as hypertension, heart attacks, and strokes, CVA. Essential tips for dealing with low air humidity. Given the risks presented, it is essential to adopt simple and effective measures to minimize the damage of dry weather. Drink more water and stay hydrated. Increase your fluid intake, even without feeling thirsty. Prioritize water, natural juices, and flavored waters. Avoid diuretic drinks like coffee and sodas. Humidify the environment. Use wet towels, buckets, or basins of water in rooms, especially in the bedroom at night. Use air humidifiers, if possible. Hang damp clothes inside the house to help raise the air humidity. Avoid appliances that dry the air even more, such as heaters. Take care of the respiratory tract and eyes. Use saline solution to hydrate the nose and eyes, preventing irritation and bleeding. Avoid exposure to dust and pollutants, which become more concentrated in periods of low humidity. Perform nasal washes whenever you feel discomfort or obstruction. Reduce intense physical activities at critical times. Avoid outdoor exercise between 10 a.m. and 4 p.m., the period when air humidity reaches its lowest levels and temperatures are high. Prefer to start your physical activities in the early morning or late afternoon. Maintain environmental hygiene. Clean the house with a damp cloth, avoiding raising dust with a broom or vacuum cleaner. Wash curtains, rugs, and stuffed animals frequently or remove them from the environment. Leave windows open for ventilation whenever possible. Take care of your skin and lips. Use body moisturizers after showering and whenever you feel your skin is dry. Apply lip balms to prevent chapping. Protect vulnerable groups. Small children, the elderly, and people with chronic diseases need even more attention. Be alert to signs of dehydration, excessive dryness, or worsening of pre-existing diseases, and seek medical advice whenever necessary. Warning signs. When to seek medical help. See a doctor if you observe persistent or worsening symptoms, such as difficulty breathing and wheezing in the chest, frequent nosebleeds, intense eye irritation, exacerbated cough, sore throat, and fatigue. Signs of dehydration: dry mouth, dizziness, small amount of very yellow urine, skin without elasticity. Proper diet during periods of low humidity. Opt for water-rich fruits, such as watermelon, melon, orange, and pineapple. Consume legumes, greens, and light foods. Reduce the use of salt, as it contributes to dryness. How to prevent respiratory diseases in dry weather. Avoid closed environments and crowds. Double down on hand and contact surface hygiene. Keep the vaccination schedule up to date, especially for flu and pneumonia. Staying informed and adopting practical measures is the best way to face periods of low air humidity. Take care of hydration, humidify the environment, and be attentive to your body's signals. Prevention is the key to preserving the health and well-being of the whole family during the dry weather months.